I've never seen morale so low throughout the whole of the NHS. People are just worn out now, burnt out, exhausted.
The day before the first of 2 unprecedented nurse strikes, the choice to walk out weighs heavily on those who deliver care.
If we don't do this now, then things are just going to continue the way they are, and things are going to get worse for patients. And everyone is making an assumption that this is all about the pay. For so many, it's about working conditions. You know, it's about nurses going into the toilets to cry because they just feel that they're unable to, you know, as much as they want to provide that quality of care that, you know, patients need and deserve, they're unable to do so because of staff numbers.
The staffing crisis is part of the decision to strike. By last count, there was a record high of almost 50,000 nursing vacancies in England and Wales. And after almost 3 decades in the NHS, Leanne is seriously considering leaving too.
It's going to be heartbreaking, you know, if I do consider going. It's not something that I ever thought I'd say. When I started my training in the 90s, I thought that was it. I was in the NHS until I retired. People need to put food on the table, and the cost of living crisis has affected so many people. I think that was the breaking point really for a lot of nurses.
Trans-Pennine Express service to York is delayed.
Stagnating wages squeezed by rising costs has led to disputes across multiple industries. Today, railway staff and postal workers braved the cold in a series of strikes over pay and working conditions. In the Commons, the Prime Minister defended his stance on pay.
Mr. Speaker, nurses going on strike is a badge of shame for this government. Instead of showing leadership, he's playing games with people's health.
It's worth putting on record what exactly we have done for our nurses. Last year, when everyone else in the public sector had a public sector pay freeze, the nurses received a 3% pay rise.
Nurses will still provide emergency care tomorrow, but routine services at affected hospitals will be impacted. Their ask of a 19% pay rise to make up for years without one is a demand that even Labour have said they wouldn't meet.
I agree, it seems like a large number, but it gives people room to negotiate. I earn above the national average wage. I'm still going home and I put one light on in my house. I can't afford to stick my heating on for more than an hour a day. I'm cooking one meal a week because I know that there's not enough left in my wage packet.
What about patient safety? Do you accept that some people will suffer during the strikes?
The reason why it's such a difficult decision to strike is because we know that there are huge numbers of people waiting for care. And I guess, yes, you have to accept that that will have an effect, and we're sorry for that. That's not what we're setting out to do, but we've come to a point where we're not sure what else to do.
If no deal is agreed before, nurses will walk out again on the 20th of this month, followed by paramedics, physios, midwives and potentially junior doctors next year. The hope for those that rely on the NHS is frosty negotiations thaw out before the impact of normal winter pressures takes hold.
Anya Pop there. Well, chief nurses are warning that people across England and Wales are being put at risk by tomorrow's NHS strikes. Earlier, I spoke to Chris Hobson, Chief Strategy Officer for NHS England, and I began by asking him whether people will die due to this industrial action.
Well, there will be disruption tomorrow, but we're working incredibly hard, including negotiating and talking with the unions, to ensure that patients are kept safe and to ensure that services are kept safe. And that's the NHS's job on these occasions when we do get disruption, is to ensure that we minimise the impact on services, but above all, we keep patients safe.
Well, as I understand it, some of those services affected include A&E, cancer care, mental health care. Intravenous antibiotics won't be delivered in a timely manner. Is it therefore, you say services will be disrupted, people's lives will be disrupted, and people will die, more people will die because of this action?
Nobody comes to the NHS, comes to work in the NHS in the morning to do anything other than provide the best possible quality of care, and that implies whatever day of the week it is, whether there is strike action and disruption or not. We are talking to the trade unions to ensure that we protect those services which carry the most risk. So absolutely vital that that job is done. That's what we're in the process of doing.
So where have those talks got to? I mean, are you urging the unions to allow their members to cross picket lines to provide some of those services I just mentioned?
Well, it will be up to each individual member of our staff to decide what they wish to do, and it will be up to each individual trust to agree the precise operation of how those derogations, in other words, which services are exempted from strike action, will actually work in practice. And obviously it's our job to support our staff and to ensure that the best possible quality of care is provided. If you don't mind, Cathy, the one bit I really would like to stress is just in terms of where we're up to for tomorrow's strike day. If you're a member of the public wondering what you should do tomorrow, can I just reinforce three key messages? The first is the strike isn't affecting every single trust. It's actually only 44 hospital trusts that are affected. So if you've got a booked appointment for tomorrow, you should definitely attend that appointment unless you have been told that that appointment has been postponed. The second message is if you need medical care, then the first port of call is 111 online, and that will give you the advice that you need. The third message is that clearly if you have a life-threatening incident, then you should continue to do as you normally do, which is ring 999, and we will ensure that care is dispatched as quickly as is needed.
Your Twitter bio says that you're on a mission to inform and explain what is going on in the NHS. So I wonder if you could explain why, despite real terms increases in funding for the NHS, the health service is actually seeing fewer people in hospital, treating fewer patients in hospital, despite that extra money. What's going on?
Well, so we know that the NHS is under a number of different pressures. We're seeing record levels of demand, and there is definitely emerging evidence that we have a sicker and iller population post-COVID. Second, like every other advanced Western health system, we are coming out of COVID. The third is that we do have 13,000 medically fit patients who are in hospitals that can't be discharged because of the pressures in social care. And you know, we've been talking a lot over the last few months about the pressures in A&E departments, the pressures on ambulances and ambulance handovers. That's because of the fact that we can't discharge those patients. We also know that we do have insufficient capacity in the NHS, which is why we are seeking to put in 7,000 extra beds over this winter, and we're doing everything we can to make that extra capacity permanent. And we also have 130,000 staff vacancies.
Even Labour now says that the NHS needs to be reformed. Do you accept that whoever wins the next election, there needs to be changes to the way the NHS operates to make it more efficient?
We're really focused on doing three things, Cathy, at the moment. The first is we know that we need to recover and stabilise our core services. The second is we know we need to get back to delivering the ambitions we set out in the long-term plan. But the third bit is we absolutely know we need to transform the NHS.
Chris Hobson, thank you very much.
Thank you.